This presentation by the Heart Innovation Research Program team is about how to use the online screening tool called the Prodromal Symptom Screening Scale, or the PSSS. It covers when to use it, where to find it, and how to use it. There are very early warning signs of heart disease that many people experience, called prodromal symptoms. This screening scale is your way to monitor your symptoms. It also asks about your risk factors of heart disease. Once you complete the questions, you can email or print a report of your results. These can then be brought to your healthcare provider to discuss your current symptoms and your heart health. These early warning signs are displayed in this picture. These 13 possible warning signs that you may experience are indicators of developing heart disease. These will be evaluated using the screening scale. When to use the screening scale. If you have any concerns about heart disease, either from family history or your past history, or if you have some symptoms that you cannot explain, you can use the screening tool. You can use it more often if you notice new or returning symptoms or changes in your symptoms. You can also use this as a yearly tool to help measure your heart health. It provides a way to talk to your healthcare provider about your heart health and is based on the most recent research findings. You can use it with your healthcare provider to assess your level of risk of heart disease. This information can be added to your health record and updated each year. You can find the scale at catchheartdiseaseearly.ca or sokeefemccarthy.ca under resources. You can access it either on computer or your mobile device. How to use the scale. Once you go to the website, you will see this starting page. There is some background information on the page, and to access the questions, click on Go to Scale. It can take some people 20 to 30 minutes to complete the scale. If you leave the website, your data will be lost, so it is best to choose a time that you can focus on this and finish and print it or save before leaving your computer. In the risk factor questions, you will be asked your current weight and to measure your waist circumference. Here is a diagram of how to find your natural waist. It is the midpoint between the top of your hip bones and below your lowest rib. To access the questions from this screen, again, click on Use the Scale. The first question is on unusual aches and pains. If you do not experience them, select No, and then select Next Question. If you are unsure, you can click on I don't know, skip, but we recommend not doing this on too many questions because then you will get results that are less meaningful. If you do experience aches and pains, click on Yes, and then once you make your selection, click on Next Question. If you select Yes, you will be presented with two body diagrams, one of the front and one of the back of the body. Select the areas in which you have experienced pain, and you will get questions about the severity and the frequency of these pains. Continue through all of the body parts that you have experienced aches and pains in. If you realized you entered a body part by mistake, you can select it again and select Delete under the Save button. Once you have selected all the areas that you experienced the pain in, select Next Question. You will be directed to the next question, which is about fatigue. Again, select No or Yes, and if you select Yes for fatigue, you will be directed to answer questions about the intensity and frequency of the fatigue. If you select Yes, but then don't select these options, you will get the prompt like this. Once you answer the intensity and frequency, click Next Question. You will go through the rest of the symptoms like this. You can track your progress by using this part of the scale, and once you get through all of the symptoms, you can answer questions about your risk factors. If you get to this screen, you can go to the risk factors by selecting this button. As before, you can select Yes or No or I don't know for each of the questions. If you are unsure of the risk factor, on some of them you can select "What's this?" and it will bring up a window with an explanation. Some questions, such as "Do you eat a heart-healthy diet?" will ask for further information. Select the items you eat, and then select Next question. Enter your height and weight to determine your body mass index. It can enter either in metric or imperial based on what you are familiar with. And here is where you would need your waist circumference, and it can also be imperial or metric. The results screen. Once you answer all of the risk factors, you will get your results. It will have information based on your specific results and what to do next. You can have 3 levels of urgency of your results: green, yellow, or red. Green means a low level of urgency. Yellow means that you have some signs and to begin the discussion with your healthcare provider. Or red suggests that you need to have an urgent clinical follow-up with your healthcare provider to test your heart health. Further down the page, it has information about what your score means and the results. It shows each of the symptoms and the risk factors, and you can use these to track changes in your symptoms and heart health. If you bring your healthcare provider this report, you can show them the symptoms that you were experiencing, and if you choose to do the survey again, you can keep track of any possible changes in your results. You can either download the results into a PDF format or email the report directly to yourself or your healthcare provider. For more information, you can go to Behind the Research or sokeefemccarthy.ca. Thank you for watching this video. For more information, visit sokeefemccarthy.ca.